And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. And we have often talked about diabetes on this program.
Absolutely.
And we seem to have a huge diabetes problem here in Southeast Texas.
It's a big deal. The world, actually, not just in Southeast Texas. It's a cultural, national issue just because of the way we eat, the way we live. It's a huge problem. It's not something that necessarily doctors can do on their own. We have to get the patients involved and basically keep re-educating them about the link of their lifestyle and the development of diabetes. Certainly some people have a genetic predisposition to develop it, but doesn't mean they have to develop it. But certainly if they're sedentary and they're overweight and they're eating a lot of the foods that are processed, engineered, not real food basically, then their chances start to skyrocket. And there's a lot of medicines on the market that are very well tolerated, that work really well, but certainly the idea is prevention, and we just have to keep talking about it over and over again to let people know that it is preventable, especially if you can diet and exercise. Cut your reduction by 70–80%.
That's huge.
It's huge, and so we're doing it to ourselves, unfortunately, and we just have to try and find ways to get people to eat right, drink the right things, exercise a little bit. Doesn't have to be 2–3 hours a day. We're talking about 20–30 minutes, 5 days a week, so small strides. Same thing with smoking. Just continue to re-educate and highlight those issues, because I think still people don't really get it, and so it's still important for myself, even in the clinic, to just keep telling them over and over again, bash them over the head if I have to get them to understand that.
Do you think most people feel as though if there's a medication out there that that's the cure-all?
Well, yeah, I mean, it's part of our culture. Doctors believe in it. We like the quickness of writing a prescription for a pill that can very quickly and easily cure or fix or solve the solution. Diet and exercise and lifestyle modification changes, that's so hard. It takes so long.
It takes a while.
You have to adjust so many variables. Some of them are not in your control. And so it's very easy to, yes, you're right, take a pill and keep on going. We do it all the time, and a lot of times it's even difficult for physicians to know what to say to patients when they're in the office, because we're people too, and we have our own issues with our own lifestyle, so it's difficult. So yeah, the pill solves and cures everything, and we just have to try and get away from that, but you're talking about a huge problem, okay? So
get back to the basics.
Always get back to the basics, like eating at home all the time. You know, the home cooking that we used to do when I was growing up, we hardly ever went out to eat. Now we're eating out all the time. It's just too convenient, it's too cheap, it's too readily available. And we just have to get back to controlling our own food and eating the food at home that normally is the best route, just because we can control the ingredients.
All right, on to some of our viewers' medical questions. This person wants to know, what medical necessity is it for cool or ice water over tap water, or is there one?
I don't think there is, especially if you go to Europe. That's what you told me.
Just drink it.
Yeah. You know, in Europe, they don't drink anything.
They don't give you ice. I know that.
Yeah, absolutely. So I don't think there's any medical necessity. It's just comfort. We like cold water, especially in the heat. It's nice, but I don't think metabolically wise, it doesn't have to be cold. I know if
doesn't rev up your metabolic rate.
No,
or anything?
I think if you're having a problem with being overheated and you're in the hospital and you have toxicity from heat, then certainly yes, we try to deliver water or fluids that are cooler. That allows the body to cool faster, because your body can't function with very high heat. So that's kind of a medical emergency. But the average person who's out there, no, it does not have to be cold. It can be warm.
All right, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. An older woman had shingles a year ago. It's not going away. Her face is still swollen. She's losing hair, and she has problems seeing. What should she do?
It probably sounds like she had a severe case of shingles a year later. Most of that should have been resolved, but as you know, or we may not know, shingles can cause chronic pain. It can cause chronic problems with the nervous system, the skin that it infected, and possibly the eye if the shingles involve the eye. So it probably is a chronic problem, unfortunately, for her. Not quite sure how much can be done to reverse that. Certainly getting back with her primary care physician, maybe a cosmetic dermatologist, a plastic surgeon might be able to help her, but it sounds like it's chronic considering it's been a year out.
Okay. A 63-year-old woman says she stays dizzy and she wants to know why.
Dizziness is a very complex, very broad symptom to figure out. A lot of times it's what we call multifactorial. It's from several different reasons. A big one would be medications. As you know, as we get older, we tend to be on more medications and more pills, unfortunately. So those pills come with side effects. Dizziness is one of them. But cardiovascular disease, anemia, thyroid disease can all contribute to dizziness. Certainly that typically involves a big, broad workup for any primary care physician or healthcare professional to figure it out. And at the end of the day, sometimes we don't find a cause. Sometimes just aging in and of itself can contribute to dizziness. Our neurological system, our cardiovascular system tends to deteriorate over time and can create some symptoms such as dizziness, typically mild and you can function. It's kind of an annoying symptom you have to deal with, but certainly get an evaluation.
Okay. A 61-year-old woman in September of 2013, she was diagnosed with HPV. She still hasn't been able to get into a gynecologist. Any advice?
Probably I would just keep looking. HPV, human papillomavirus, increases your risk of cervical cancer. So at her age, her risk certainly is lower. So not a crisis in and of itself, but certainly, as you know, gynecologists are very busy. Sometimes they can see their primary care physician. You don't necessarily have to go to gynecologists to get these type of questions answered. Sometimes other healthcare professionals, PAs, nurse practitioners, do a lot of women's health. So I don't think this is a crisis. I would keep looking, maybe even go out of town if there's an issue with getting a local gynecologist, but just keep looking, grinding it out.
Okay. What statin drugs don't have your liver enzymes go up?
I don't know of any, to be honest with you. That's a class, what we call class effect. That's the way these medicines work. Some medicines within the statins, some are more prone to that, like Pravachol. We like to use that because it has less side effects. Crestor as well, but all of them potentially can cause elevation of the liver enzymes. We still check it, don't see it as often, but patients still are vulnerable.
Okay. This person has been having problems for months with their throat, having white spots and bleeding in their throat, headache, their neck hurts, and she's also hoarse. They had an antibiotic, it didn't work. What should she do now?
Sometimes I will add prednisone. I believe in it a lot. I use a lot of steroids in my practice. It helps with a lot of the inflammation in the throat, which is what she's describing. The throat just seems inflamed. May need to use a different antibiotic. Certainly if that doesn't help, go to an ear, nose, and throat doctor. They have instruments and techniques that can further the diagnostic capability. So keep going. Try a different antibiotic, maybe a steroid, the combination of the two.
Okay. What are the side effects from fluid in the ears?
You know, not really much. You just might have some discomfort in your ear, may sound muffled, may get a little dizziness. Sometimes it can get infected, but certainly you'll have a lot of fever and pain, hearing loss, ringing, but the fluid actually can stay there. We don't get aggressive unless the symptoms warrant it.
All right, Dr. Levine, as always, we appreciate you stopping by and answering all of our questions. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. You can fax us 892-7305, email us at laf@kftm.com, or you can post those questions every Monday on our KFDM News Facebook page.